Hi, it's Dr. Dale Patterson. I'm here with a COVID update on the 13th of October 2020. Well, as most of you probably know, we are seeing increasing numbers of infections and transmission within our community, and things have gotten pretty busy at all of our facilities. Right now, we are also seeing a higher number of associates being tested for COVID, and I wanted to give some updates on some things you can do to protect yourself and some of the things that we're seeing. We still are seeing a lower rate of infection in our associates in the community, which is good. It means that you've been doing a great job to protect yourselves. Most recently, the exposures that we've seen at work have not been in patient care, but in people letting their guard down and working with others. People in break rooms who are eating that aren't social distancing, people who work closely with each other on a daily basis that aren't wearing their masks when they're in close proximity to each other. And when people are eating, they're taking off their masks and they're not distancing from others in the cafeterias and other areas. We've had several instances where one of those people then tests positive, and we have exposures to those other people that they work with when they weren't wearing a mask. So please take that into account and separate and distance while you're eating or while you're on your breaks, and continue to wear the right PPE as you have been when you're taking care of patients. We talk a lot about the things that you're not supposed to do, and we want to tell you some of the things that you can do, things that are within your power to do to prevent the transmission and to protect yourselves. And that means keeping your distance, wearing your mask, even with those you work closely with every day, and wearing a mask the right way. It should cover your nose, it should cover your mouth and go over your chin. And we do see people walking around with masks under their nose, and remind them to pull them up and put them over their nose and have them over their mouth. And most importantly, for those taking care of patients, when you go in to see a patient, make sure you have a paper surgical mask on, as that's the most protective to you. The cloth masks are okay to wear when you're out walking around the hospital. If you're not involved in patient care, that's fine. But when you walk into a patient room, make sure you have glasses or goggles and a paper mask on to best protect you and our patients. Thanks for all you do, and keep up the great work, and we're all in this together. Thank you.